Hello, everyone. Good evening. I'm Steve from UCAN English Tutoring, which has been offering a range of courses on IELTS, OET, and PT examinations since 2008. I've been helping more than 12,000 students to achieve their desired scores in these examinations. And this is a free session which I have arranged to help you guys out to understand the importance of using the phrases and expressions along with the tenses properly in your OET letter so that you should be able to pass your examination. Okay. So, firstly, what we need to do is that everyone knows that we need to use a range of sentence structures such as simple, complex, and compound in the OET letter because it is one of the key assessment criteria, right? So you have to use a range of sentence structures such as simple, complex, and compound. But apart from that, there is a better way to showcase your linguistic features in your letter, and that is by using a wide variety of phrases and expressions which can be advantageous if they are used appropriately. All right. So I know it is very difficult for many students to pass their OET writing subtest because of the complex nature of the assessment criteria. However, in this video, I'm going to address a few of the criterion so that you can get to know what they are all about. Okay. It is highly recommended not to commit any grammatical mistakes when you write a complex or a compound sentence. All right. If you're not 100% confident about the accuracy of the complex or the compound sentence, please split that longer sentence into two simple sentences. It is still acceptable. Okay. If you're unable to write down, the complex or the compound sentence, it is okay to split it. All right. Because although they expect you to use a range of sentence structures, it doesn't mean that you have to use only the complex or the compound sentences throughout your letter. You can have some simple sentences if you feel that the sentences you're writing down are not grammatically correct. Okay. So the bottom line, the main thing in writing section is that you should not commit any obvious mistakes. Okay. You shouldn't commit any obvious mistakes. That is going to be one of the major things which can put you up in the risk of losing your marks in the OET writing subtest. Okay. Let me give you a list of phrases in the beginning first before we move on to the detailed sections. Okay. So there are a couple of examples that are given here. You can use them in your letter. Okay. But you have to change according to the situations of the patient. Okay. So you can, for example, when you go through the first phrase, I have written down before Miss Jamie's visit or prior to Miss Jamie's visit, comma, and then you have to write down, whatever the information you want to write down. Okay, so this is just a phrase only, but according to the patient's name, you have to change it a bit. Okay, and then you can also write down this phrase because of her allergic reaction or due to her allergic reaction, comma, and then you can write down the second part of the sentence. Okay, so these are only the short phrases that can help you out to improve your writing skills. Right, you can also write down like this: following Mr. John's surgery or after Mr. John's operation, comma, and then you can write down whatever the information you wanted to insert here. Okay, so owing to his illness, comma, and then you have to write down whatever the information you wanted to write down here. Okay, as a result of heavy smoking, comma, and then you can write down the the second part of this sentence. Okay, you can also use other forms of connecting phrases like this apart from that. Okay, apart from that, in this case, this is going to be a linking phrase. It links to the previous sentence. If you write something else before that, it's going to link that one. Okay, and then after the patient's discharge, comma, and then you have to write down the second part of the information here in this sentence. Okay, and this, in spite of his medication compliance or despite his medication compliance, comma, and then you will write down the contradicting information. For example, in spite of his medication compliance, comma, he was unable to recover. He was unable to recover. Okay, so in that case, in spite always goes with the preposition. You need to use in spite of. Okay, you can't use in spite only. You have to use in spite of. However, when you have to use despite, you have to use only despite. You shouldn't use any preposition after that. All right. So these are some of the phrases, just I would like to let you guys know so that you can use them correctly. Okay.
It's not clear. No. Network.
All right. Are you able to hear me? Okay. So if you couldn't hear it properly, okay, let me increase the volume. I'll show you the screen once again. Sorry. I'll share the screen now. Is that clear now? If some people are not able to see the screen, it means the network may not be that good, at your side. All right. Okay. Let's go to the next section. Referring to the names of the addressee or patient. Okay. So this is one of the major areas where many students find difficulties with. Okay. They don't know how to write down the names of the addressee or the patient in a letter. Well, I have got a few tips, for you guys to work out. All right. Whenever you write down the addressee, you need to write down their full names in the addressee's contact section on the top. So once you start a letter, you have to include the addressee's contact details, isn't it? Including the addressee's full name and then their designation, the name of the organization where they work in, and so on, right? So when you write down the addressee's name for the first time, you must write down in full only. Okay, you have to write it down fully. All right. But when you have to write down their salutations, okay, moving to the salutation section, you have to use only the surname of the addressee, because the addressee is always an adult. Okay, the recipient of the letter is always going to be an adult, and as a result, you have to use only their surname in the salutation part of the letter. Okay. For example, let's say these are the full names of the recipient. Okay, we have got Mrs. Maria Jacob, Mr. James Cameron, and Miss Amy Wynyard. Okay. When you write down, these recipients contact section, you have to write down their full names on the top. However, when you have to write down the salutation, you will write down only the surnames like this. Dear Mrs. Jacob. Look at this. For Maria Jacob, we have to write down Dear Mrs. Jacob. All right. And for Mr. James Cameron, we have to use Dear Mr. James. Sorry, Mr. Cameron. It must be Mr. Cameron. That was a mistake. Okay, sorry. It should be Mr. Cameron. Okay, so you need to write down only the surname. And then you have to write down Dear Miss Wynyard. So once you write down the salutation, it is a must to place a comma. Remember that use of punctuation marks is going to be one of the key assessment parameters as far as the OET writing subtest is concerned. So wherever required, you must place the punctuation marks such as commas and full stops. You need to use those punctuation marks in an effective manner so that they are visible to the assessor. All right. You need to ensure that you place the punctuation marks that are clearly visible. All right. You can't just use invisible marks in your letter. It's not good. Okay? You have to use sufficient size in order to showcase that you have placed a comma or a full stop. All right. I hope everyone is clear about the way we need to refer to the addressee. If anyone has any questions, you can just ask me.
Sir, I'm Nancy.
Yes, Nancy. Yep.
Sir, sometimes they will give 3 names.
Yep.
Maria, Rose, Jacob.
Yep.
At that time, how can I
Well,
write?
if the addressee has 3 names, the first name would be the first name, and then the second one would be the middle name, and then the final one would be the last name. So you have to use the third name, that is the last name, when you have to write down the salutation. For example, as you already mentioned, let's say Maria James Jacob. All right. In this case, you got to use Dear Mrs. Jacob only. Don't write down Dear Maria or Dear James or so on. No, it's not the case. Okay. So you got to use only the third name. In that case, it's going to be the last name as well. All right. Particularly for, some, ethnic groups, they will have 3 names. All right. So you have to use only the final name, in their full name. All right. Then you have to write down the salutation.
Okay. Thank you, sir.
No worries. For patients, whenever we need to refer to the patients, okay, there is a number of ways, that you can refer to, and it depends on the age of the patient as well. Okay, so we can classify the patients into two different categories. One is the adult and the other one is the child. Okay, adult patients are going to be aged 18 and above, whereas the children can be below 18. All right, that is how we refer. Okay, so for the adult patient, when you have to write them down, okay, their name in the reference section. So we have got two sections, isn't it? One is the reference section where we have to write down the details of the patient, including their name and then their age or maybe the occupation as well. Some people write down the occupation also. So you can write so. In the reference section, you need to write down their full name only. For example, look at this. This is the reference section. You have to write down regarding Mr. John Smith, 23-years-old. Remember that you have to write down hyphens in between them. This is one of the acceptable formats of writing down the age of the patient. Okay, there are few other acceptable forms as well. You can also write down aged 23, all right, and so on. Okay, and yeah, so as we are writing down here, the patient has got two names. One is the first name and the other is the last name. Sometimes the patient may have three names as well. If that's the case, you have to write down all three names here. For example, regarding Mr. John Jacob Smith, 14 years old or whatever it is. Okay, so you just need to write it down. All right. I hope you guys understand what I mean here. Okay, let's go to the next section.
Sir, I have one doubt in the salutation.
Yes, please. Yeah. May I know who's this?
Shishma, sir.
Yes.
Sir, if the address is not given, that means to the community health nurse.
No.
So in that case, in salutation, whether we can write as dear nurse.
Yeah, you can write down dear community nurse, or dear nurse. It is highly
Okay.
recommended to use the addressee's designation if the addressee's name is not given. Do not use dear
Okay.
sir or madam. Okay.
Okay, sir.
Good.
Thank you, sir.
Okay. In the introduction paragraph also, we have to write down the name of the patient in full according to the new recommendation raised by OET official website. Okay. So you have to write down like this. This letter is being written to update the health status of Mr. John Smith. Okay, and then you write down who requires or whatever, like, you can write down the, the remaining information. Anyway, so in this case, we are writing down the full name of the patient as well. When you look at this, I have written down Mr. John Smith. Okay. However, moving forward, I mean, in the remaining supporting paragraphs, when we have to refer to the name of the patient once again, we are going to use only the surname of the patient. Okay, or their personal pronouns such as he, she, him, her, and so on. Okay, his, all those things. Okay, for example, during hospitalization, this is one of the supporting paragraphs where we have to write down. Okay, so we are writing down like this: during hospitalization, Mr. Smith. We didn't write down Mr. John Smith once again. No, because we have already given the full name of the patient in the introduction paragraph and in the reference section of the letter. So we don't need to provide the full name once again here. Okay. For children, the rule is going to be the same for both the reference section and the introduction paragraph of the letter. However, when you need to write down further in the supporting paragraphs, you have to use only the first name of the patient. Okay, if the patient is a child. Remember that it is exactly opposite to the adult. For adults, we need to write down the surname of the patient, whereas for children, we have to use only the first name. You need to understand these things, okay? But the remaining details are going to be the same as far as the reference section and the introduction paragraph are concerned. For example, let's say we have written down regarding Vamuya Obiki, 4 years old, all right? In the introduction paragraph also, we're going to write down the same thing. We're going to write, I'm writing to refer Vamuya Obiki, and then who requires or whatever it is. Okay, and then when we write down the supporting paragraph, we are going to use the first name of the patient. We are writing Vamuya, not Obeki. Okay, so that's the major difference between the reference details of the children and then the adult patients. All right. I
Sir?
hope. Yes.
This is Indra. I have a doubt.
Yes, Indra.
Sir, in the reference section, already we are mentioning the full name of the patient, right? So in introduction paragraph also, we need to mention the full name.
Yes, that's a new recommendation given by the OET official website. So we have to use the full name.
Even for the introduction paragraph
That's right.
also.
That's correct, yes. But only in the introduction paragraph, not in the supporting paragraphs, not in the remaining paragraphs or the remaining sections of the letter.
Okay, I did not update it. That's why, sir. Thank you.
That's a recent update anyway. All right.
Yeah.
Let's go to the next section. So the next one is going to be, hello, yes.
This is Bharti.
Yes, Bharati.
Actually, for the children, we can use that baby name. Just we can use a baby full name. Just a full name.
Of course, you can say the baby and the mother. Okay, when you have to refer to the baby. Okay, if the baby is only say 1 month old or maybe 2 months old or 2 years old or so on, if you need to refer them, you can mention the baby as well. Okay, that is acceptable. Okay, all right, you don't need to mention them. Using their name again and again. You can use the baby. That's fine. All right, when you describe the people and their situation, so this is going to be one of the important sections as well. Whenever we need to write down, the details of the patient, we need to come across their situations as well. For example, you can say a single mother, a single father, a single parent, a widow, a widower. Remember that a widower is the man who lost his wife, whereas the widow is the woman who lost her husband. So don't mix them up. Don't make a mess in this particular section. Okay, it's very simple. Okay, let's say the one that ends with the ER is for the boys. Okay, is for the males. Okay, and the one without ER is going to be the female. So a widow is a woman who has lost her husband recently or so. Okay, I hope you understand the difference between them. So don't mix them up. For a woman who lost his wife, don't write down Mr. James is a widow. If you write Mr. James is a widow, that's wrong. If you write down Mrs. Jacob is a widower, that's also wrong. So be mindful about that, please. Okay. If the patient has already retired from his position, you can use a retiree as well. Okay, see, you need to show a range of vocabulary in your letter. If in the case notes they have mentioned Mr. James has retired from his position last year, you don't need to mention the same phrase retired. You can use he is a retiree. All right, so try to show at least some synonyms in order to improve your score under vocabulary, because vocabulary is also one of the assessment parameters, unfortunately. Okay, I would recommend my students to use at least 60 to 70% of the synonyms of the words from the case notes instead of repeating them again and again. Okay, you can change the verb form of the noun. Okay, you can change the noun form into verb and so on. All right, so you can make small things that can show a variety. All right, I mean, instead of saying he's a retired man, you can say he's a retiree. All right, so you can show some kind of variations in your words. All right, and then a diversity instead of saying divorced. Okay, or separated, divorced, retired. All right, so in the case retired, use a retiree in your letter. If the case notes has got a retiree, use retired in your letter. Okay, so in this way you are showing that you understood the case notes very well, and you have been trying to interpret the information to the addressee. All right, that actually helps the assessor to identify your skills under vocabulary section. Okay, so it is really important that you do this. And then the next one, you can use an aged pensioner. Remember that an is one of the articles that needs to be used before any words that start with the vowel sound, not the written form, but the vowel sound, not necessarily to be the written form anyway. So this means aged care, aged starts with one of the sounds created by A. A, E, I, O, U. So these are the vowels anyway in English. So it is not necessarily to be the written form of the vowel as well. It can be different. For example, when you have to write down Mr. James is an honest man, okay, you shouldn't say honest man, Honset. That is wrong. Okay, you should say honest only. H is going to be silent, in which case the vowel sound starts with the O. Okay, honest. Ah is one of the sounds created by O, one of the vowels anyway. Once again, so use of articles is another important criteria. I have uploaded a range of videos on my YouTube channel to the use of articles, prepositions, and so on. Okay, so you can have a look at them, and I'm gonna upload this video as well to my YouTube channel so that if you wish, you can watch it and leave your comments anyway. So a single mother pensioner, okay, a disability pensioner, a carer's pension, defector, partner, spouse, wife, husband, fiance or fiancée, on the unemployment benefit, on workers' compensation, sibling or siblings, children, the only child. So you can use these kinds of phrases, when you have to interpret the information from the social background of the case notes. Use at least some synonyms. It's really important that you show a variety of vocabulary. All right. Okay, let's go to the next one. Okay, so this is even more important. We do get lots of dates and time and things like that in our case notes, isn't it? Sometimes you do get lots of visits, in the past, and they will be lined up like anything. Okay, so in that case, it would be much difficult for you to pick up what would be the relevant one and how you need to interpret the information. But I would strongly recommend my students to interpret the dates in form of the time references wherever applicable, instead of writing down the same dates in your letter. It's not good if you write down the same date. Your score will be increased dramatically, okay, if you can interpret the information of the dates in the form of the references of time. For example, let's say today's date is maybe, let's say today is maybe 11th of June, for example. All right, and the patient was admitted on the 10th of June. Okay, in the case notes they mentioned on the 10th of June the patient was admitted. It is yesterday. Don't say on 10th of June the patient was admitted with the complaints of blah blah blah. It is very bad. You should not do that. You have to understand the case notes very well, and you have to show that you are writing down today. All right, so the patient was admitted yesterday. Don't write down on 10th of June 2018 or so on. It's not good. Similarly, if the patient was admitted 2 days ago, please write it down 2 days ago or the day before yesterday or so on, instead of writing down their dates. It's not good. Similarly, a week ago, a month ago, wherever applicable, please use them, or after 2 weeks. If the patient needs to be referred to someone else, or if the patient has got an appointment after 2 weeks, please use after 2 weeks instead of writing down the date. So how do we identify the date? Now, how do we need to change them? Well, it's very simple. Look at the date of your letter. Okay, if today's date is 11th of June, all right, and then the patient has an appointment on the 18th of June. Let's say today's date is 11 and the patient has got an appointment on the 18th of June, which means you have to subtract these two numbers. Okay, so 18 minus 11. So in a week's time. In a week. So you can use in a week. It's very easy. The same thing is applicable when you have to subtract the dates, in the past as well. Say, for example, today's date is the 11th of June. Okay, today's date is the 11th of June. However, the patient was admitted on the 4th of June. Okay, which means instead of writing down on the 4th of June the patient was admitted, you can use a week ago, because 11 minus 4 is going to be 7, right? 7 days ago. So which means, in other words, a week ago. So it's better to say a week ago. Okay, so that's going to be of great help. So you need to interpret, such information in your letter. It's really, really important. Okay, so try not to write down the date as they are given in the case notes. You have to interpret them. You have to tell them after a month, after 2 weeks, okay, 2 weeks ago, a month ago, and so on. It is always important that you do this, okay? All right. Wherever is not possible, okay, if you cannot, for example, the patient might have been admitted 50 days ago. You don't need to write down 50 days ago. It doesn't make sense, right? You have to write down on 12 December, for example, if that's the case, all right? But wherever possible and wherever applicable, you have to use the time references instead of writing down the same dates from the case notes, please. If it is today morning, don't say today morning, you have to say this morning. Okay, that's what I would like to, tell you. Does anyone have any questions regarding this expressions of for time and date? Does anyone have any questions here? All right, let's go through the next section. I hope you understand these things. Okay, writing about patients' visits. See, there are a number of ways that you can use in order to write down the information regarding the visits by a patient. Okay. So following sentence structures and expressions can be used in the letter. Please note, if the patient has several visits to the hospital, you need to summarize them and provide the information in one sentence or maybe in 2 sentences possibly. Okay, not more than that. So if you have got some relevant information from the previous visits, please try to summarize them. Don't try to write down every date and then the events that occurred in every visit. It's not good. All right. For example, let's look at these ones. Mr. James came to me with the complaints of vomiting, nausea, and severe headache. Sorry, severe backache. Okay. Remember that backache is one word only, whereas back pain is going to be 2 words. See this one. Back pain has got 2 words and backache has got one word only. The same thing is applicable for headache. Headache is going to be only 1 word. Okay. Don't give a space between head and ache. That's not good. Remember that, please. Okay. So Mrs. Harry came to the hospital complaining of severe back pain, especially when lifting heavy items. So try to, start with the simple sentences in the beginning when you write down the letter, and slowly try to add the information at the end of a simple sentence to make it a complex or a compound sentence structure. That is the best way to deal with your grammatical accuracy. Okay. So in that case, you should be able to slowly build up your confidence in terms of the sentence structures. Okay. All right. Look at this one. She was presented with nausea, it should be nausea only, sorry, nausea, vomiting, and headache. All right. Look at this. Today, she was brought to the hospital by her daughter.
How can we write was?
Sorry, what's that?
Can we write was presented?
Yeah, she was presented. Yes, of course. Why not? She was presented. If she was presented by someone else, yes, you have to mention that. See, there are 2 situations. For example, there may be an adult patient and there may be a child. Okay, so for the child, you need to, they need to be accompanied with their parents, isn't it? You can't have them alone. They can't present themselves. So in this case, it is going to be an infant or a child. Okay. Look at this one. So the second one is going to be perfect. So she was brought to the hospital by her daughter. So her daughter brings her to the hospital. Do you understand? So in that case, this is going to be the passive voice form, and as a result, you have to use an additional verb here along with the main verb. The main verb is brought, whereas was is going to be the one which can make this a passive voice form. It is highly recommended to everyone to use as much passive voice structures as possible in your letter instead of the active voice. Okay. Right. When you look at this one, during Mrs. Jacobs' first visit yesterday, abnormal heart rhythms were observed. Okay. Look at this. This is the way you need to write down the sentence structures. Okay. This is what we call the passive voice form. Abnormal heart rhythms were observed. So we are not going to say I observed, or don't say she has been observed with abnormal heart rhythms. That's not correct. Okay. That's not correct in this case. This is the best way of writing down the passive voice form. Okay. Look at this one. She was worried about her health condition, or she was concerned about her mobility. He was concerned about becoming addicted to alcohol. Look at the way we have written down this structure: about and then verb plus ing and then addicted to something. When you see the case notes where they have mentioned that he has been increasingly consuming alcohol or so on, you can use this sentence structure. Okay, he was concerned about becoming addicted to alcohol. If someone keeps on increasing the consumption of alcohol, you can use this kind of structure. Okay. Miss Janie's father brought her to the hospital. So this is what we call the active voice. This is an active voice. She was brought by her father to the hospital. That's going to be the passive form. Okay. I'm just writing down a range of voices so that you can understand the information clearly and the difference between them as well. All right. Look at this one. In her following visits, she reported vomiting in addition to the existing symptoms. So we didn't mention about her previous problems or so on, or previous symptoms. We don't need to, because it's not good. It's not relevant as well. So we'll just pick it up, this one. We'll pick up the vomiting only, because that's going to be the relevant symptom from the medical history. And as a result, we are going to include this in our letter, all right, rather than writing down the previous symptoms. You can just simply mention the existing symptoms. That's it. In addition to the existing symptoms, she reported vomiting in her following visit. You can rearrange the sentence as well. That's fine. I'm happy with that. All right. So these are the ways you need to write about the patient's visits. Okay. I've got a few more sentence structures. So let's go through this. The patient came back after a week with no improvement in his mobility in spite of his adherence to physiotherapy sessions. Look at the sentence structure. Isn't it awesome? I have written down in such a way that I have clearly stated, what happened, okay, to this patient. So the patient came back after a week with no improvement in his mobility in spite of his adherence to physiotherapy sessions. So he tried to follow the physiotherapy activities. However, he couldn't improve his mobility. All right. So if you look at the next sentence, look at this. The patient visited the hospital again yesterday and reported a significant improvement in her walking ability. I tried to use as many different words as possible. For example, in the case notes, if they have mentioned his walking has been decreased or declined, you can use mobility in your letter. You can use ambulation. Okay. So you can use different words. All right. You can also use the noun verb form as well. He's able to mobilize. You can also use that. Okay, so you can use a range of words. Okay, they are going to be small things. Okay, they are easy to follow. They are easy to adopt, isn't it? You're not going to think about the synonyms that are going to be less frequently used, but you are just changing the form of the words from the noun to verb and so on. As I have already mentioned, you have to use a range of sentence structures. Okay, you can use these kinds of things. No improvement in the patient's weight was noted in his visits last month. Okay, look at this one. In the past 3 years, Mrs. Jacob has come for regular screening. All right. The patient has made good progress after following the prescription medications. Look at this one. Progress is an uncountable noun, which means you shouldn't use any articles before that. Do not write the patient has made a good progress. That is wrong. That is one of the severe mistakes. And unfortunately, that is one of the most frequently committed mistakes by many students in the OET writing subtest. You should use made good progress rather than made a good progress. Okay. After Mrs. John's discharge, may I request you to monitor her medication compliance and encourage her to adhere to a balanced diet. Okay, look at the way I have used this sentence structure. I tried to combine two requests, to the addressee into one sentence itself, isn't it? It's good because we don't want to write down a letter with more than 220 words or 240 words or so on. It's not good, isn't it? If you write down more than 220 words, whatever the information that you're going to include after that will not be taken into account for assessment. So they're not going to assess it. So if you have included, unfortunately, an important information after 220 words, it's really difficult because you're not going to get good score. Can I ask you guys to mute your microphone if there is any background noise, please? Okay.
Sir, whether can I write, may I request, sir?
Yeah, that's all right. May I request? Yeah, that's okay. Yes, may I request? It's going to be really polite.
Please.
Could you please? You can also say, could you please?
Okay, sir.
That's fine. But you need to show a variety. Okay, so if everyone is writing down the same structure, for example, after Mrs. John's discharge, could you please monitor her medication compliance and encourage her to adhere to a balanced diet? It's not good, right? Everyone is writing down, isn't it? See, you need to use polite words. You need to use formal expressions, formal words, okay, that can show politeness, okay? Although speaking can be a semi-formal conversation, writing is 100% formal. It's 100% formal conversation only. So you're going to write it down anyway in the writing section, okay? So you need to use only the polite words, all right? Okay, so look at this one. Following Mr. Cooper's discharge today, arranged a physiotherapist to provide ongoing support to enhance his mobility. Okay, so that's how you need to write it down. All right, look at this. Arranging hydrotherapy sessions as well as social activities for Mr. Ramamurthy would be beneficial. So I tried to include two things in one sentence itself. Look at this. Hydrotherapy sessions plus social activities. For example, these are just examples only in order to help you to understand the way we need to structure or the way we need to summarize the information so that we can write down a crispy letter. Okay, we don't want to drag the letter like anything. It's not good. It is always better to write down a short yet crispy letter which can cover all the important case notes of the patient. Okay. All right. When you have to
sir, we need to
sorry, one at a time, please.
Okay, sir, whether we need to put question mark after his mobility, that two sentences there, no, sir?
Can you see this? Could you?
Okay.
So could you please? Okay, so when you don't write down this could you, if you write down only please arrange a physiotherapist to provide ongoing support to enhance his mobility, you need to put a full stop. Whereas if you ask a question, okay, it's a kind of request in the form of a question. When you need to request, okay, in the form of a question, you have to place a question mark after that. And you don't need to place a full stop after that. Don't place a full stop again after this question mark. It is wrong as well. Some people do, but it's wrong. Yes.
Okay, sir.
What's the next question? Sorry.
Sir, arranging or arrange?
Okay, so let's go through this. Okay, see, arrange. Where is that? I think it's here, right? Yes.
Last one.
Last one. Here. Okay, yeah. See, look at the sentence structure. Read it fully. Don't say arrange hydrotherapy sessions. What I have written on, look, when you read it, it will be clear. Arranging hydrotherapy sessions as well as social activities. Okay, it's a singular action altogether. All right. So if you use arrange, okay, then it's going to be arrogant, a bit arrogant. Okay, you are going to order the patient. You're not request the patient. If you write arrange hydrotherapy sessions as well as social activities, you're not requesting them politely, but you're ordering them. Okay, it's not good. So when you write down arrange, okay, then you have to remove these ones. Would be beneficial. You have to remove this phrase. Would be beneficial needs to be eliminated from here. I mean, you shouldn't write it down here. You need to remove that. Then you can write down arrange hydrotherapy sessions as well as social activities for Mr. Ramamurthy, and then put a full stop. Okay. But that's not good. Why? Because you can't start any sentences in the letter with the verb, okay, without using any polite phrases. You can use also please arrange. Otherwise, please arrange hydrotherapy sessions as well as social activities for Mr. Ramamurthy. That is okay. That is acceptable. All right. But don't start a sentence by saying ensure the patient takes enough fluids. That's wrong. Please use kindly ensure, or please ensure, or could you please ensure, something like that. You have to use those polite phrases in order to make your letter more formal. Do you understand?
Yes, sir.
Can I have other students' questions as well? I think someone was asking a question. Does anyone else have any questions?
Sir, I have one more doubt, sir.
Yes.
Here the third sentence is there, no, sir, after for which you have put one comma.
Yes.
And somebody told me that before for which we need to put comma. I just confused regarding that, whether before for which or after for which we need to put comma.
Well, okay, well, actually, when you write down without for, okay, if it is, for example, okay, I'll write it down, I'll tell you clearly, okay, all right.
Okay.
The patient suffered from headache, okay, and then comma, which was controlled by medication now. Do you understand?
Okay.
In that case, we have to place a comma before which. But if you use for which, okay, it is going to be one single phrase and it refers to the previous condition. Okay, whatever you have mentioned here, whatever you have mentioned previously, that is going to be the previous condition. And for that only, hospitalization was recommended, okay, or commenced or initiated, whatever it is, okay. So for which, after for which, you need to place a comma, okay, if it is referring to the previous information in the same sentence. But if you don't write down for which, but if you write down only which, for example, the patient suffered from headache, comma, which is well controlled by medication now. So that's okay. In that case, you have to place a comma before which, not after which.
Oh, okay.
After which is incorrect in that case, okay? Got it?
Oh, okay.
All right.
Okay.
Let's go to the next one. Describing events or examinations taken during hospitalization. Okay. See, clearly writing down the events or the patient's examinations during the hospital stay is critical to achieve a high score in your OET writing subtest. I mean, you can write down like this. Advice about oral hygiene was offered to Mr. James. Metformin 500 mg thrice a day was prescribed. Diabex 250 mg was commenced. An X-ray was conducted that revealed the bone fracture. He was requested to come back to the hospital in a week. It's always recommended to use, polite phrases, requested, instead of saying he was asked to come back. All right. Requested is more formal than asked. So try to use as many formal phrases as possible, please, to make your letter sound like a formal letter. Okay. And look at this. During hospitalization, there must be a comma. Wound dressings were applied every day. Look at the way I have used the passive form. Wound dressings were applied, because wound dressings is going to be a plural noun in this case. So I have used were applied. All right. A bandage was applied, because that's a singular noun, a bandage. A review was arranged in the following week. Don't say she has been arranged a review in the following week. That is wrong. You have to use a review was arranged for her in the following week, or without using for her. It's okay, because we are referring to the same patient anyway. So intravenous fluids were initiated for Mr. James, due to which, comma, he regained his health condition. Okay. A biopsy was carried out. An injection was given. Her switches were removed, because switches is going to be a plural noun here. Her dressing was changed regularly, because of which her wound, so it should be wound, I'm sorry, it's wound, okay, W-O-N-D, O-U-N-D, was healed completely. All right. Okay, so try to use these kinds of phrases. For example, owing to which, due to which, because of which, and then put a comma after that. Okay. If you use these kinds of phrases, it's going to be of great help for you to score well under the grammar assessment criteria. And look at this one. To treat the patient's condition, he was catheterized and sedated. Okay, so that's good. Vamuya's mother was asked to bring him back the following day. I mean, they are asking the patient's mother to bring him the next day. Okay, the very next day. All right. These are the phrases, that you have to use as far as the events or the examinations during hospitalization is concerned. Okay. Let's go to the investigations. If we need to request some kinds of investigations or tests or something like that, so how we need to use. Look at this one. A range of blood and urine tests was requested. It's not where. Why? Why it's not where? Does anyone have any clue here? Why we didn't use where? Because urine tests and blood tests are going to be a plural noun, isn't it? But we didn't use where here. Is it a grammar mistake? No. This is correct. The reason is that this verb, this verb was is not referring to the test. It is referring to a range. A range is a singular noun. So we have to use a range of blood and urine tests was requested, not were requested. If you write it down, it is grammatically incorrect. Okay. The patient was sent for an X-ray. That should be the next one. And look at this one. An X-ray was arranged to diagnose the patient's current condition. Okay. All right. Let me go to the next one. Reports and findings on examinations. When you get some kinds of results, how we need to write them down clearly. Okay. So use these kinds of examples, and then you can change, the test name accordingly. Okay. According to the situation of the patient, you can use that. The radiograph demonstrated, and then that you can write down whatever the information that you got. The electrocardiogram showed. Remember that it is highly recommended to expand the abbreviations in your letter. Please do not write down DOB when you have to refer to the patient's date of birth. It's not good. See, you are writing down a formal letter. Again and again, you need to be mindful about that. You can't write down ECG and so on. But if you don't know the expansions of the abbreviations, do not incorrectly expand them. Okay, that's the rule actually. So if it is highly recommended to use the expansions of all the abbreviations, otherwise you can use the abbreviations, but try to use it, less instead of overusing them too much. Okay. Look at this one. Blood tests showed an increase in red blood cell count. Okay, look at this. Increase is going to be a singular noun here, and that's why we have got an. What happens if I used increased? If you used increased here, we don't need any article here. You can simply say blood test showed increased red blood cell count. That's it. All right. And see this one. The results of blood tests were normal. All right. We have used the verbs and nouns correctly in this case. In this case, we used the plural verb, where, because the subject is the results. That's a plural noun as well. So where goes with the plural nouns. That's correct. Good. An endoscopic examination revealed maybe blah, blah, blah. So it can be anything. Okay. Maybe a condition or so. All right. The patient's vital signs were within the normal range. Remember that within is one word only. I have noticed some of my students who have been committing mistake by writing down within as two different words. They write down with and then there is a space and then in. That's wrong. Within must be one word only. Please understand that and try to stick to this. Okay. So within the normal range. That's what you got to do. Okay. When you describe the patient's medical history, okay, following sentences could be of great help. You have to use a history of. Remember that, don't write down the sentences without this article. You have to use an article here. Mrs. Joseph has a history of drug abuse. All right. Mr. James has a 10-year history of diabetes mellitus. You need to use a, because a is an article that needs to be used with the history. What happens if I use approximately 10-year history? You need to use an, not a. No, you have to use Mr. James has an approximately 10-day history of diabetes mellitus, for example, if it is a 10-day or a 10-year or so on. And you need to be mindful about the use of the syllables in between as well. You need to use a hyphen between the number and the duration. Okay, so 10-year should always have an hyphen in between. 5-day in between, there should be an hyphen. Can I use a plural noun here as a 10 years history? That is wrong. That is definitely wrong. It is not good at all. Okay, right. Mrs. Smith presented to the hospital with a 2-week history of dizziness and nausea. Look at this. Look at the way I have written on, with a 2-week history. It's not with the 2 weeks history. That is wrong. Okay, that's wrong. Okay, if you are really keen to write down the plural noun, you can write it down in a different way. You can write Mrs. Smith presented to the hospital with the history of dizziness and nausea for 2 weeks. So you place this 2 weeks in the end of this sentence, not here. If you want to write down the plural noun, use it in the end with the history of nausea or dizziness for 2 weeks. That's okay. That's good. So you write whatever the way you write, but ensure that the sentences are grammatically correct. That is what we need. Okay. If you're not comfortable in this one, do the other way around. That's fine. As long as I'm happy with your letter, which is free from grammatical mistakes, you are going to score more than what you are aiming at. All right. And I'm going to assess, your first letter at free of cost as well. For the students who have joined this meeting, are going to get the free assessment. It's going to be a free word by word assessment. I'm going to assess every word that you write in your letter, and you're going to get the assessment against each parameter plus the overall score along with the word by word assessment. Okay, so that's a bonus for you guys. Okay, you can also ask your friends or relatives or colleagues as well, to share with me their first letter. So the first letter is assessed at absolutely free of cost. Okay, you don't need to pay anything for that. And look at this one. Miss Vineyard was diagnosed with the hepatitis C in 2010. All right, the patient has had an appendectomy 2 years ago. Okay, so these are the ways you can write down. See, these are the simple sentences. Okay, you can also use complex or the compound sentences, but it's up to you. Like if you feel you are really good at that, you can use that. Otherwise, you can use the simple sentences. Even though you are aiming at, let's say, B grade plus, you are still okay to use some of the simple sentences. There is no harm in your score. They're not going to harm your score. All right. Okay, let's go through the next one. Writing about frequency and duration. When you write the frequency and duration of the treatment or the medications or anything else, the following phrases can be used. Remember one thing, that since can only be used with a year, a date, a month, or something. It should not be used for a duration. Don't say the patient has been suffering from depression since last 2 days. That is wrong. That is one of the major mistakes that are frequently committed by many students. Never ever use since with the duration. Don't say since the 3 days. That's wrong. It should be for the last 3 days. You have to use far over there. But when you have to write down a year or a date or a month, I mean a specific time, okay, a specific time, you can use since. That's fine. That's absolutely correct. Okay, so the patient has been suffering from depression since 2008. Sorry, since 2006. So it is ongoing now, and that's why we have used, the present continuous tense. It has been and then verb plus ing. I'm sorry, someone was asking me a question.
Yes, sir. The patient has been suffering from depression since February 2006 is correct.
That is also correct. Yes, you're right. That's correct as well. Also, since 21 June 2006, that is also correct. Yes, because it is a specific time. It's not giving the duration. If you write it down, look at the one here above. Mr. James has been nauseous for the last 2 days. Don't say since 2 days, since the last 2 days. That's wrong. That is one of the major mistakes many students commit. So I'm warning you guys to prevent those mistakes in your letter, please. Okay, write an impressive letter that can fetch you more than what you are aiming at, please. Okay, and look at these ones. Mrs. James has had an episode of choking 2 days ago. Remember that episode can be a countable noun, which means we can have 1 episode, 2 episodes, 3 episodes, and 4 episodes, and so on, several episodes. Okay, so you have to use an article before a countable noun. So an episode. So the article can be either an, a, or the. Okay. Look at this one. She has several episodes of headache. I have used plural noun here. Okay, good. She has had many episodes of headache over the past 3 years. All right, over the past 3 years. Many episodes. You can also use many as well. Various, many, several. Okay. He had experienced a dizziness for 2 days before his visit today. So before he arrived at the hospital today, he has had dizziness for 2 days. Okay. Mr. James has been nauseous for the last 2 days. Remember, this has been. Okay, we are using an adjective here. What happens if I use a noun here? Has been nausea for the last 2 days. That is wrong, because we don't need a noun in this case, we need either an adjective or a verb. Okay, I mean verb plus ing anyway. All right. She has had occasional headaches in the past. All right. The patient experienced pain frequently. The patient has intermittent pain in her right shoulder. You can use either the right shoulder or her right shoulder. Both of them are good. You can use any of them. He was hospitalized twice in 2007. So do not write down details about each visit. It's not good because it's the same thing. But you can mention, the information shortly after that. Okay, for example, he was hospitalized twice in 2007 due to maybe something, maybe a condition. You can write it down. That's all right if you wish. If it is relevant, again. Throughout the whole letter, you have to write down only the relevant information. Remember that. Okay, it goes without saying that only the relevant information needs to be mentioned in your letter. All right. And see this one. He has been a diabetic patient since he was 19 years old. This is also a time. Look at this. He was 19 years old. Okay. It is not for the last 19 years. If he has been a diabetic patient for the last 19 years, you need to write down for the last 19 years. But this was a time. This was a specific time. So when he was 19 years old, it was a specific time from there. From then, he has been suffering from this diabetes. Okay, diabetes mellitus or so on. Okay. Look at this one. She fell over and fractured her arm last year. She had an extraction a week ago. She wore a neck brace for 3 weeks after her surgery. She ceased hormonal replacement therapy 2 months ago. He had surgery in 2008. The patient suffered from psychiatric problems for the last 7 months. Look at the way I have used for here. You need to use the prepositions effectively and correctly. You can't use since the last 7 months. If you do so, please stop. Please stop now. Otherwise, your score will go down in the real examination. Okay. All right. I hope you understand what I have been explaining to you. All right. When you have to describe the changes in health conditions, we have got a number of phrases that you can use. It's really important that you describe the significant changes in a patient's health status so that the recipient understands the patient's situation well. It's really important that you include this in your letter according to the case notes. Look at this. The rash has spread to other parts of his body as well. Yes, you need to clearly state that. For example, the rash might have been started with the face of the patient, but it has been spread out to other areas as well. You have to mention that, please. There has been a significant improvement in his mobility. So do not simply say he is now able to walk very well. Instead of that, you can use these kinds of phrases and sentences as well. And look at this one. The wound has been healed well. Her condition was stable. His pain was decreased owing to pain medications. Okay, it's owing to, because of or due to, which were commenced yesterday. Okay, good. So I have just added this in order to make it a complex sentence. Up to this, it is a simple sentence only. His pain was decreased owing to pain medication. That is only a simple sentence. Okay, but I have just explained this one. What is that? This one, pain medications. I used the WH questions after them. Okay, which were commenced yesterday. Good. That is again a passive form. Okay, his pain was increased, was decreased, or whatever, So this is the way you need to use the passive voice in your letter. Okay, look at this one. The patient's condition has become stable after the hospitalization. That's good. The patient's red blood cell count has become normal following the blood transfusion, which was held yesterday. Good. So the blood transfusion was held yesterday, isn't it? But I mentioned which to make it even more complex. All right. So this is a complex sentence. If you say the patient's red blood cell count has become normal following the blood transfusion, if you stop here itself, it's a simple sentence. So what I have done is, I haven't done much. I have just added a question mark, a WH question, and then I have just expanded it, which was held yesterday. The pain was worse. Okay. The patient's mobility has been consistently decreasing. Okay, so which means the patient was not able to mobilize himself. All right, and unfortunately, it has been deteriorating like anything every day. All right, look at this. Mr. John has attained excellent recovery post-operatively. You can also write post-operatively in the end as well. But what happens if I reverse it here? If I mention it in the beginning, you need to place a comma after that. You need to place a comma post-operatively, comma, Mr. John has attained excellent recovery. That's good. A weight loss of 5 kilograms. It is recommended to expand kg into kilograms. And then there must be a space between 5 and kilo. Okay, there must be a gap. Writing down enough space between two words, okay, leaving enough space between two words is highly recommended under the layout parameter. Okay, layout is one of the key assessment parameters as well. It means whether your letter is readable, whether your letter is clean and tidy, so that the assessor doesn't have enough difficulties in order to understand the information that you have conveyed through your letter. Okay. So look at this, a weight loss of 5 kilograms was observed. I didn't use where, why? Although I have written on 5 kilograms here. Because this verb is not indicating this noun. It is not for this noun. It is for this noun, a weight loss. A weight loss is a singular noun. So obviously was would be the correct one in the past. Was observed because of his poor diet and less fluid intake. Okay. The patient had lost 10 kilograms in the last 3 months alone. Okay, I'm using alone because I just wanted to stress the importance of helping him to increase his weight, because he is now underweight. Okay, he's gonna lose his health condition, and as a result, it is really important. For example, this sentence can be written down to a dietitian. Okay, for instance. All right. Okay, look at the next one. A slight improvement in his mobility was witnessed due to his adherence to physiotherapy sessions. Good. So this is a complex sentence as well. So we are going to use, due to his adherence. Try to use, instead of using compliance, you can use few other words like adherence and so on. Okay.
Sir.
Yes.
Sir, whether we can use the article in front of slight improvement, significant improvement, whether it is countable?
Of course, improvement can be a countable noun, yes. So you have to use a slight.
It's not like a progress?
No, it's not progress. No.
Okay. So we can use article, right?
That's correct, yes. So it depends. If you use, slight here, you have to use a, whereas if you don't use slight, and you have to use an improvement. It's not a improvement, okay? Remember those rules, okay?
Okay, sir.
Yeah.
Okay.
So his mental stability has been continuously declining over the past 3 weeks, which made his wife concerned about their life. Okay, see this one? I have just added this one to make it a complex sentence. Simple. It's very easy. Writing down a complex or a compound sentence is going to be really easy if you understand the rules in English. Okay. All right, let's go to the next one. Providing advice and recommendations to the patient. Following sentence structures can be applied in your letter while offering suggestions to the patient. Look at this. The patient was advised to contact Quitline program and stop smoking. She was advised to make some lifestyle changes to improve her overall well-being. Mr. James was recommended not to lift any heavy items or participate in physical activities, at least for the next 2 weeks. So we are clearly stating the duration as well. All right. Bed rest for 1 month was suggested for Mr. Smith to recover faster. Education about a range of stretching and strengthening exercises was offered. Okay. Reducing the consumption of alcohol was strongly encouraged. The patient has been encouraged to participate in many social activities with the help of a social worker. Taking part in light exercise programs and physiotherapy sessions would be of great help. Got it? So these are some of the phrases, where you can request the addressee, okay, to arrange something. All right. Requesting the recipient to provide care to the patient. It's really important that you need to be polite when you have to request the addressee of the letter to render a range of services to the patient. It is crucial, okay, if you're aiming at achieving B grade plus. All right. What are the phrases? Look at this one. If you could assist the patient with his daily living activities, it would be greatly appreciated. What happens if I reverse this sentence, if I put it would be greatly appreciated in the beginning, then I should not place a comma here. Okay, if I write it down like it would be greatly appreciated if you could assist the patient with daily living activities, there should be only one full stop in this sentence. There shouldn't be any commas. You need to understand that. So if you're really keen, if you're fond of placing the punctuation marks, then start writing a sentence with if in the beginning, not in the end. Okay, see this one. Could you please remind the patient about his appointment at 1 o'clock at the Royal Perth Hospital the day after tomorrow? Don't say on the day after tomorrow. Okay, all right. Could you please arrange a social worker who can encourage the patient to involve in social activities regularly? I would be grateful to you if you could monitor the signs of infection for Mr. James. It would be great if you could take over the management of Mr. Larry after his discharge today. Sorry, that shouldn't be any question mark. It must be a full stop only. I'm sorry about that. It would be of great help if you could assess Mr. Perry's swallowing ability and provide treatment as you feel appropriate. It must be a full stop only. Sorry, I'll fix these mistakes. There are a couple of punctuation errors. When I was preparing, I didn't notice them. Sorry. Arranging regular home visits for Mr. James would be beneficial, for which I would be grateful to you. Okay. So we are trying to write down as many different phrases as possible when we have to request the recipient.
Yes.
Now, as I already told you, you have to place a comma when you write down a sentence with if in the beginning.
Okay, sir.
But if you reverse it, it's the way we need to remember it. Okay, see this one. It would be greatly appreciated. So we are going to put this one in the beginning, and then this comma will be changed into stop.
Between.
Are you making notes? It seems to me that you are a serious candidate. All right, that's good. That's good. All right.
Thank you.
No worries. Okay, using tenses appropriately is another issue with many students, isn't it? So we are going to go ahead with this one, and then I'll give you some ideas on what to be written down. Okay. Although there are several tenses in English language, students who appear in OET examination often find difficulties on the use of appropriate tenses in sentences. Okay. While simple present and simple future can be easily and effectively applied by most of the students, use of simple past, past perfect, and present perfect tenses can be tricky, even for the brightest students, isn't it? So becoming well-versed with the range of tenses in a range of situations is critical. It's really important that you use the tenses appropriately and correctly, all right? Either the simple past tense or the past perfect tense can be used to describe the events that occurred in the past. However, you have to mention the timelines of the events clearly so that the assessor understands the sequence of events well. Some of the examples for the same are mentioned below. Okay, look at this one. We have used, both the simple past and the past perfect tenses here. Okay, look at this. Mr. Smith's wife first noticed the lump 1 week before his first visit to the hospital. Okay, so she first noticed, okay, we are clearly telling that, okay, she noticed this before their visit to the hospital. So she knew that already, all right? The patient started vomiting again today. So this means he vomited previously as well. So we are clearly telling this, see this one again today.
Again.
Yes. So this means he did something in the past as well. He did vomit in the past, or maybe yesterday or the day before yesterday or so on, okay? Mr. Swikinder Singh has had pain for the last 5 days. See this one, for can go with the duration. So for the last 5 days or for the past 5 days or so on, okay? Mr. Jane's tooth was broken yesterday during a volleyball match. The patient has had 2 panic attacks in the last week itself. Okay, I'm just clearly telling itself, which means this patient is a severe case. Okay, so we are clearly stating the purpose and the urgency as well. Okay, the patient's leg has swollen and their leg pain has become worse. Okay, has become worse. All right. Mr. Shane has had an appendectomy in 2001 and a cardiovascular accident in 2004. You can also write down in a different way. If you want to save, some words or so, you can write like this. You can write like this. Mr. Shane has had an appendectomy and a cardiovascular accident in 2001 and 2004. That is also fine. Yes.
Then it is necessary to write respectively last.
Yes, that's right. If there are two things, yes, you have to mention that. Yeah, sorry, I forgot to tell you that. You have to mention that, respectively. Because when you list out a range of things, okay, and then you write down all the timelines, okay, then you have to mention respectively after that. I forgot to tell you, sorry. So it was a good pickup anyway. So he broke his teeth while chewing a chicken's bone. Okay. The patient has suffered from slurred speech for the past 3 weeks. Don't say since the past 3 weeks. That's wrong. It's for the past 3 weeks. Okay. All right. Now let's come to the past perfect tense. Right. Past perfect tense, however, requires to be used to demonstrate the sequence of events or to show that one event in the past occurred before the next event in the past. Okay. Please read the following sentences. Yeah, it's going to be like a list of events. For a list of events, you can use the past perfect tense, the one that starts with the had and so on. Past perfect tense. That's what we call past perfect tense. So had always goes with the third form of the verb. I mean, the past participle verb. Had participated, had undergone, and so on. Okay. So go through the following sentences to distinguish the difference between the past perfect tense and the simple past or the present perfect tense. Look at this one. The patient had fallen down the stairs the day before yesterday, before her visit yesterday. So it's like, if you don't use this one, it's going to be a bit difficult. So we are clearly telling that this occurred first, and then this occurred next. Okay. So sorry, yep. Do you have any confusion here? So the first event, so usually the past perfect tense is used when you have to write down, two things, two events in one sentence itself. For example, look at this.
Past perfect.
Yeah, past perfect. Yeah, had and then a third form of the verb, that is past participle verb. Had plus past participle verb. That's what we call the past perfect tense. Okay. And look at this. Miss Helen had consumed 3 standard drinks of alcohol prior to her visit. So this occurred later. This occurred in the beginning. So this was finished actually. This was finished. She finished consuming 3 standard drinks of alcohol, okay, before she started visiting the hospital. Okay. His condition had
Following.
Again before, sorry, what's that?
Sir, whether we can use Miss Helen had consumed 3 standard drinks of alcohol following her visit. Following her visit is after that. Prior is before that.
After that, yeah.
So you can't use, I mean, you can use she had consumed. That's okay. If it occurred in the past perfect tense, yes, you can use that. That's all right. You can use that. Okay. All right. The patient had been involved in a road accident before her appointment yesterday. So this was the appointment. Okay. This was the event that occurred before. But unfortunately, she had been involved. You can also use had been as well, or had and then the third form of the verb. So Mrs. Joseph had experienced severe shoulder pain prior to her visit yesterday. All right. Before Mrs. John's arrival at the hospital, she had an episode of panic attack. She had. Why? Because this was the one, but before that, you can also rearrange the sentence as well. You don't need to mention it, here. Do you know what I mean? Before her appointment yesterday, you can also write it down in the beginning as well. But we are clearly using this phrase. Look at this. Before, prior, or after, following, those kinds of phrases need to be used to clearly state the sequence of events. Okay, I hope you guys found out the session useful. If you have any questions, please ask me now and I try to answer them. Does anyone have any questions? Can I ask maybe one by one, if you don't mind? Can I ask Amberly Prince? Do you have any questions, Amberly?
No, sir.
Okay, good. Anita, do you have any questions? Do you have any questions, Anita? This one, Huawei Y9S. Do you have any questions? Can I ask Shishma Lal?
Shishma.
Do you have, yeah, Shishma, yeah, Shishma, yeah. Do you have any questions, Shishma?
Sir, regarding connect keys now,
Yes.
which all are the connect keys we can use?
Okay, that's a good question. Well, actually, firstly, secondly, thirdly should not be used as far as the writing subtest is concerned, but they are acceptable for the speaking subtest. Okay. You should
Okay,
not use moreover, so besides, what else? I think, yeah, these are the ones you should not use. All right, you should be able to avoid these phrases. Okay, try to use other phrases like in addition, also, however, but, and so on. Okay, yeah,
Okay, sir.
all right, but try to
Okay,
avoid the use of other phrases like moreover, so, firstly, secondly, thirdly, and so on. Okay.
Okay.
All right, good. Ansi, do you have any questions, Ansi? I'm sorry, do you have any question, Shishma?
Hello,
No,
sir.
sir.
It's me, Ambili.
Yes, do you have any? Sorry, is that Ambili?
Yeah.
Yes, yes.
Sir, while writing introduction, that how many comma we can use?
Well, you can use as many commas as you wish. Okay, it depends on the sentence structure that you are writing down. Okay, it varies actually from one student to another. So it's up to you. Like you can use either the compound sentence or a complex sentence. Okay, you can come with the maybe 2 commas or even 3 commas. It's up to you. All right, it depends on whether your sentence is grammatically correct or not. All right. Can I have others? Yeah. Ansi, do you have any questions?
No, sir.
Okay, good. All right. Anureka, do you have any questions?
Sir, actually, I'm facing difficulty in selecting this relevant and irrelevant portion from that questionnaires. You know, it should be according to the recipients who we are writing the letters, or the patient conditions.
Yes, that's right. Actually, we need to look into the addressee. No, we need to know who the addressee is, and accordingly, we have to pick up the case notes. We also need to be mindful about the requirements of the patient. I mean, what kinds of services does the patient need from the addressee as well? Okay. So we have to look at all these
Sometimes,
things. Okay?
In this following, a discharge plan or somewhere else, they're given only one lines. Give some what to say, consult GP like this,
Yeah, that's right. Yes.
But how we can choose?
Well, actually, yes. Well, actually, that may need a different session. Okay, altogether. Because we need to go through from the beginning, Anureka. Anyway, you have been already receiving a course from me, right? So we will have it in a separate session. Okay, I mean, a regular session. This is just a free session for other students.
Because last time I had a question to write a musical therapist. So totally, I don't know what to select, and
all right.
That is the problem.
But see, I have a clue for all you guys. Okay, usually I don't share it with others, but I have a clue for you all. Okay, so what do you need to do to identify whether the case notes are relevant or not? There is one strategy, okay, that is going to be very effective. See, firstly, you need to find out the list of possible recipients that may need to be included in your letter. For example, as you already said, musical therapist. So you have to go to google.com, okay, and then you have to write down responsibilities of a musical therapist. Okay, do you understand? Otherwise, duties of musical therapist, and write down other things as well. Duties of a dietitian, duties of an aged care nurse, duties of a social worker, duties of a whatever the occupation you put in, whatever the recipient, and then you will get a list of responsibilities. Please copy this and paste it into a Word document and print it out and keep it with you and read it at all. Read it always, because you need to think from the addressee's point of view, to know which case notes are going to be relevant and which ones are going to be irrelevant. So knowing their responsibilities would be of great help for you, isn't it? So that is what I recommend you guys to do. But I shouldn't share this with everyone, but I'm happy anyway. It's okay. But yeah, see, I have got some free advice and guidance. I'm very happy to give everyone. But there are some premium services that are available only for the students who have been already receiving courses. But yeah, this is one of the key strategies that you have to do. Okay, you have to know this. Please, you have to know. And you cannot just think from your perspective. You are not a nurse. Okay, whenever you get writing case notes, you shouldn't think from a nurse's point of view. Never ever do that. You have to go to the addressee. You have to think from the addressee's point of view. You have to think from a recipient's point of view. For example, if the recipient is a dietitian, you should think from a dietitian's perspective. Never ever think about nurse. You need to forget that you're a nurse for the first 5 minutes of reading time. Never ever think that you are a nurse. You are not a nurse. No, you have to go to the writing task and you need to know who the addressee is. And you need to think from the addressee's perspective only. You need to assume that you are a dietitian. Can you guys please unmute, mute if you have background noises, please. Apart from the ones who is asking questions, please mute your microphone. If there is any background noise, please mute it. Okay, so that's what you're going to do. So that's one of the strategies. But does anyone else have any questions?
Sir, if you're using connectives like therefore, however, in between the sentence, whether we need to use semicolon in front of therefore or however?
Well, I strongly recommend my students to not experiment any punctuation marks other than commas and full stops. The reason is that, okay, if you are really good at writing, if you know the use of punctuation marks, A to Z, then it's okay. You can play with the number of punctuation marks. But if you don't want to commit any mistakes, please stick to only commas and full stops. That is what I would recommend. Okay.
That means if in between one sentence therefore is coming, means before therefore no need to put any comma. After
no,
therefore we need to put comma.
Yes, that's right. Yeah, after the connective, yes, you have to.
Okay, yep. Thank you.
All right. Okay,
so can we use thus in our letter?
Sorry, what's that?
Can we use thus the patient underwent a surgery?
Thus is okay. Thus is okay. That's not a big deal. I mean, that's still acceptable.
Okay.
Does anyone
else? So when we have to use has had, because we can use has had like if it is a chronic case like hypertension, diabetes.
That's right. That's right. Well, actually,
but
has
so
had...
you have used like
yeah.
But you have used there like, the patient has had appendectomy because the incident has been already over, so we don't have to use has had. We could have like the patient had undergone an appendectomy.
You can use that, because we don't know whether it is going to happen once again. So the situation is different in that case. In his case, he may need to undergo something else once again. Okay. If you have no ideas, for example, some operations are done once only, and other operations may need to be done once again. You know what I mean? I mean, it depends. If you have used a has had, it means that it's all done. You don't need to undergo any operation of the same kind once again. Okay. I have prepared the examples just to give you an idea. Okay. To be honest, these are not to be taken, exactly as I have mentioned. Okay. Because some of the conditions, okay, may need to be operated once again. Do you know what I mean? For them, you can use has had. Whereas if there is a situation, there is a operation which was already completed and it is not going to be repeated again, then you have to use had. That's fine.
Okay, then one more thing is like about any panic attack. It's like he got a panic attack day before yesterday maybe. But then like we should write he had a panic attack, or we have to write has had panic attack.
He has had a panic attack because panic attacks may come in the future as well, isn't it? You can't guarantee that that would be the final panic attack. We don't know. So there is uncertainty, and as a result, you should use, has had. Anyway, so yeah. So does anyone have any other questions? Please ask me, and I'm gonna finish the session if you don't have any questions.
And sir, one more thing. How can we conclude the letter?
Well, you have to use either yours faithfully or yours sincerely. If you know the person already, okay, if you know the name of the person, you have to use sincerely, because if you know someone, you are going to be sincere to them, isn't it? If you know them.
Yeah.
Yes. But if you don't know them, if you don't know their name, if you only have the designation of the recipient, then you can only have faith in them. That's it. You can't be sincere to them if you don't know them at all, right? So you have to use yours faithfully. So that's the reason behind the use of yours faithfully versus yours sincerely. I have created a video on this on my YouTube channel. If you wish, you can go to YouTube, and then you can search UCAN English Tutoring, and I have created this video on the use of on the use of a range of aspects as far as OET examination is concerned. I have uploaded more than 200 videos just for OET examination alone. So
Just
they include,
after sincerely,
yes,
it is necessary to put comma.
Of course, it is.
Yes.
Of course, it is. You have to place a comma after both faithfully and sincerely.
Okay.
Yep.
Then sometimes in 4 digit will be come in that in recipient name, along with in address it will be there. That time also before 4 digit we have to put comma. Am I right?
Is it 4 digit? I couldn't understand this. Sorry, what's that?
Sometimes it will
is it 4
in
names?
address it will be no, not name. 1, 2, 3, 4
the
something.
numbers. Okay, the numbers, isn't it?
Numbers will be there.
Okay.
In that case, we need to put comma before that number.
No, you don't need to. But you have to give a space between the number and then the street name or the road name. For example, 18 Blacktown Road. So you don't need to place any comma after 18 or after Blacktown Road. So when you write down address is contact. Sorry, what's your question? Sorry.
If it is 4 digits, means we have to put comma or not?
No, I'm not getting you exactly. Is it digits
like
or numbers?
Melbourne, comma 4041.
You don't need to. It's not needed. It's not needed. In the address is contact details. Okay, it is the old-fashioned method. Okay, where people used to place commas after every line. I mean, it's not a mistake anyway, but it's not recommended. Okay, it's not a mistake anyway. So you need to understand that. See, in OET examinations, they have got two things. One is the requirement, and then the other is the recommendations. Okay, so recommendations need not to be applied. However, if you don't follow so many recommendations, they are going to have an impact on your score. Do you understand what I mean? If you don't follow one, it's okay. It's still it's not going to affect your score. What was your next question? Sorry.
And one more thing, sir. Before concluding, just if it is a referral letter, is it okay to mentioning that thank you for accepting this so and so patient?
Of course,
like that?
Of course. When you look at my videos, I might have included them, because I have encouraged my students to include that. You have to say what kind of care, the addressee is going to take over as well. So it's better to mention that. All right. Okay. Thank you for accepting to provide ongoing care to blah, blah, blah. Okay. Whatever the patient.
Yeah.
We can do that. Yeah.
And is it okay for mentioning more connecting words in the first para or second para?
Well, it depends. It depends, and if they are naturally connected, then it's okay. If you're trying to pull yourself, to give a false impression that you're really good at writing and you are a master of connecting phrases, that's not good. It's going to backfire you. All right.
It's necessary. Careful. We can give. Otherwise, we can.
What you can do is you can write one letter and then send it to me along with its case notes. I'll have a look at them and then I'll tell you whether you were able to use your connectives properly and appropriately or not. Okay.
Yeah. Okay. Sure. Okay. Sure.
You don't need to pay anything for your first letter, by the way.
Okay.
All right. No worries. Does anyone have any other questions? Otherwise, we'll wind up the session now.
So one more doubt, and when we write yours sincerely, and you're a registered nurse, but they give you your name. You have to leave yours sincerely one line and then write the name, or yours sincerely below that only we can write the name.
Yours sincerely must be written down in one line, and then in the next line you can write down your name. They are belong to one section only. However, for example, if you need to write down the addressee's contact details and then the date on the top or in the below, you have to leave a blank line between the addressee's contact details and the date. Do you understand what I mean? Because they are
Yeah,
two.
that is about the recipient. But no, I'm telling you about ourselves. Like you're a registered nurse, so and so with a name. When you have to conclude more sincerely, you have to leave leave one line and write
No, you don't
the
need to.
name.
No.
You don't need to leave a blank. That's what I'm telling you. You don't, because they are the same section. Yours sincerely, and then the name of the patient, name of the sender, that is yours, are going to be the
And
same
below that,
section.
registered nurse.
Yes. No, you write down the name, that is given in the case notes. If they have given the case notes, where you have been able to find out the name of the sender, I mean if you are a registered nurse, if they have mentioned a name, write it down after yours sincerely. Okay, that's fine. If they haven't given the name, you have to write down their designation. That's it. Whatever your designation, you just need to mention that. That's it. When you mention, when they don't give your name, okay, in the case notes, you have to put the in front of your designation. So you should say yours sincerely, comma, the registered nurse, not just registered nurse. Do you understand?
Sir, if given discharge medication more than 5 or 6, then we have to write all name of medication.
Well, it again depends. You need to know whether those medications are relevant and are going to be continued, for providing the requested care by the addressee. Okay. All right. If that's you can watch maybe some of my videos, where my students have written down a range of medications. All right, and they are separated using commas as well. So if you look at them, I think you should be able to find out how they need to be included. Okay. Remember that only relevant medications need to be included, and you can write those medications once on. You don't need to mention them in two different occasions. Don't say, I mean, when you have to write down the current medications, you write it down the current medications in one section, and then the same medications need to be continued, and you write down the same thing, all the medications in the concluding paragraph, which is not good. I mean, don't write down the same information in more than one occasion in the letter. You understand? So it needs a lot of tips, a lot of guidance, okay, to interpret the case notes and write them down in a nice and effective manner. Okay. All right. So when you watch my YouTube videos, I think you'll get some ideas on how to do that.
Oh, okay.
Sorry, do you have any other questions?
Sir, in reference part, sir mentioned that please expand date of birth, means DOB in date of birth. So the letters are in small letter or capital letter.
It should be okay. D must be capital letter, and then B must be capital letter. Rest of them must be small letter. I mean, of should have small letter only. Birth, B must be capital letter. Date must be capital D.
Okay, sir.
No worries. Can you guys please, unmute? And anyway, I mean, if you don't have any other questions, I would like to conclude this session. I'm very happy that you guys accepted my invitation and joined this meeting, and I hope the session was useful to you. If you have any other questions, you can send a message to me on my WhatsApp number, which was included in the meeting invitation message as well. Okay, so you can send a message to me if you wish to get your first letter assessed free of cost. Okay. All right. Thank you all for your time. I really appreciate it, and I wish you good luck with your examinations. I'm pretty confident that you should be able to pass your exam if you know all these strategies and things like that. Okay.
Thank you, sir.
Thank you. Thank you, sir.
All right. Thank you so much.
Okay,
Take care.
thank you.
Thank you. Have a good day.
Okay.
Bye.